I'm Ebony McMorris, and you are watching Brown Box TV. We are here at the 48th Annual National Black Caucus of State Legislators, and I'm so excited to have with me, sitting right next to me, the man who's going to assume the hot seat soon, Tennessee State Representative Harold Love. How are you?
I'm doing well. Thank you so very much for the chance to be interviewed today.
Absolutely. And I said what I said earlier because some people may know, some people may not, but you are the president-elect, so you will be assuming the hot seat in a hot year.
Yeah.
2025.
2025.
Yes, let's talk about this. You know, we are here at this amazing conference, over 500 people in attendance, state legislators from around the world coming together to share ideas, to figure out what they can take back to their districts. What does it mean for you to be at this conference this year, especially after a very divisive and highly contested election year?
Well, I'll say this. The genius of NBCSL is that we provide a space for black legislators to convene and to talk about policy issues, to get information about trends in policy requests, to also have conversations about model legislation that other members have passed and brought to the conference for others to see, also to have resolutions that someone has brought to raise awareness about an issue. And so it really becomes a think tank of sorts, where members can come from various states and can have those conversations. And we always know that, really, truth be told, whoever's in the White House, whoever is in the United States Congress or Senate, we still know at the state level we'll be dealing with all the issues, because oftentimes those things get pressed down to the state and we have to deal with them and we have to make sense out of it for our communities.
It really is coming down to the states now, as we see, because we've seen a rollback of so many rights. We had before, and there's been this threat to in the Department of Education, and then we're going to find out what's going to happen on the state level. We're seeing that also when it comes to the issue of abortion being passed down to the states, and so there's a lot kind of like weighing in the balance for black legislators. What do you say to them as they go forward in this new season?
Certainly want to encourage them. Remind them that they were elected by those who lived in their districts because they believed that they could represent them in policy spaces. To remind them that we sit right between local government and federal government, and so we have to balance that off many times, which means that we have to be aware of the things that we pass at the state level and the impact it has on the local level, but also being aware of the fact that, again, as you stated, many things being pushed down to the state level that we'll have to deal with. And so for black legislators, our constituency varies. You may have black legislators who have a very low percentage of black members in their constituency, to some that have 70, 80, 90%, right? And we say to them, look, it doesn't matter whether you have 10% or 90%, you're representing your constituency in a meaningful way. And we know that when the issues that face African Americans are raised to the forefront, everybody improves.
Absolutely. Now, you talk about that. I mean, you being in Tennessee, can we delve into Tennessee a little bit? What are some of the top issues that you are facing in that state?
Tennessee is one of the few states that's not expanded Medicaid, which means that we have a high population of uninsured persons, which then translates into high health care costs, because if you don't have health insurance, you're more likely not to go see the doctor on an ongoing basis. You're not going to call your physician because you don't have one when you have pains and aches in your body. And so as a result, you prolong the process of going to the doctor. You end up in emergency rooms, and the situations you have discovered then maybe could have been discovered in your annual visit or just your occasional visit to your primary care physician. We also have the issue of education funding. We know that our public school system is woefully underfunded, and yet we're now having to deal with the conversations about privatization of education, with these educational school vouchers being brought to take public funds and fund private education. So education, healthcare, we certainly have the issue of the criminal legal system in Tennessee impacting lives. Tennessee is one of the few states in the country, maybe the only one, that has a provision where if you owe back child support, you lose your right to vote.
So when we were talking about that earlier, now I know you just left one of the sessions. Tell us about the session that you just attended.
Sure, left a session talking about the importance of raising awareness around kidney disease. going back to the issue of healthcare, right? Understanding that African Americans face a higher level of dialysis because oftentimes when the results from kidney testing is done in the doctor's office, it may not be communicated to the patient. And the instances where African Americans are predisposed, right, to be sent to dialysis. And even the conversation about dialysis is not always on balance because there is a thing called home dialysis, which allows you to still function in your normal way as best you can because you can then do your dialysis at night, which means you can go to work the next day. You can go to work the rest of the week because you're doing dialysis at night. You can travel because you take your dialysis machine with you. You can go on vacation with your family versus the traditional dialysis that many of our constituencies are pushed to because you're going to be in the dialysis for one day fully draining you, right? And then you're out for another day, which means you're out from work. And so these conversations about workforce development, conversations about sustainability of economic gains, all center around healthcare. And we have to have these conversations about kidney disease because we have to make our constituency informed and empowered to be able to ask those questions in the doctor's office to say, what's my kidney test look like? What does my blood work look like?
It's crazy that you would have the test, but then not be informed in every instance that you have kidney disease. So let's connect that to policy. What does that look like now that you have heard that information? Now what do you do with that?
It looks like many things in policy, whether it's either there's a penalty or there is incentivization, right? So you incentivize someone to do something, right? Or you penalize them. You really don't want to penalize doctors for not reporting. And so maybe there's a process for incentivizing them, right? To say that there is a financial incentive, more reimbursement if they report these figures out to their patients. So we just came out the session, so I'm going to try to figure out what that looks like over the next few weeks because we go back into our session in January, and I want to have those conversations with the stakeholders in our state about what it would look like to incentivize the medical profession because you don't want to create an antagonistic relationship between policymakers and medical profession, but you do want to say, we're aware of the fact that our constituency is not being informed across the board and say, it's not you, right? But it may be someone else in your profession. How can we incentivize them to report these things out? And a lot of it comes down to also the patient may be dealing with a whole other host of issues that the doctor may feel is more important to talk about then and not necessarily kidney disease right now. But we also let them know that it's good to let people know everything they have going on with their bodies.
I mean, I'm so alarmed that you sit here and talk about that. That's crazy, but this is the right place to have those discussions. As you prepare to get ready to assume the position, what is the charge that you have or the call to action for Black legislators?
The call to action is one that I have had for many years. It's my 12th year in the General Assembly. And the call to action has always been to advocate for the constituency you represent and to do it in meaningful and varied ways. One way to advocate may be that you have to pass legislation. Another way may be that you realize you can't pass it, but someone else can. So, you know, full transparency, my father was a legislator for 26 years and was actually there when NBCSL was started in 1977.
Wow.
And so for me, there's been this process of grooming and growing and learning. And one thing my father always said to me was, if you ever get elected, ask yourself this question: do you want the job done or do you want your name on it? And so sometimes the charge is you can't be the one carrying the bill. You have to let someone else carry it, maybe from the other side of the aisle, just to get the work done. So the charge always advocate for your people in many varied ways. Right. So maybe it's passing legislation, maybe it's conversation with the department or agency about putting the work in place without a bill. So again, the charge, advocate for your constituency.
The best way to serve.
Yep.
Before you leave, I gotta ask you, because you're on Brown Box TV, what is in your brown box, sir?
Oh, this is gonna be easy, and it may sound a bit corny, but in my brown box is love.
Were you the only one that killed it with one word? Love.
That's my slogan is keep love in the house.
And that's what we're gonna need. That's what you're gonna need in 2025. Thank you so much for coming on Brown Box TV. I wish you the best as you assume this position and in the work that you do for your constituents and representing Black legislators. Thank you so much.